Welcome to Quiet Storm Sessions. Today we are going to be talking about finding a therapist. I know a lot of people come to me talking about this is their first time ever seeking a therapist, and they have a lot of questions, but they really don't know what questions to ask to make sure they have the right fit for what their needs are. So what I'm going to do is just kind of go over some of the basic things to make sure you're the most informed when you're trying to seek therapy. So the first thing I always like to start off with is just letting people know that not all therapy is not a one size fits all, or therapists are not a one size fits all. So just because you go to one therapist and it didn't work out doesn't mean that therapy is not for you. It could just mean that you just didn't find the right fit for yourself at that time. And there could be many reasons why that particular therapist didn't fit your needs. But don't just give up just because the first person you met didn't fit your needs. The most important part of therapy is a therapeutic alliance between the client and the therapist. So if you don't feel safe with that therapist and you don't feel like you can really communicate, you don't trust that person, it can build great blocks in your process of really digging deep and kind of working on your old wounds emotionally. So just keep in mind that, just because you didn't feel good with the first therapist you went to doesn't mean there's not other therapists that will fit your needs. With that being said, also kind of keep in mind that just because you didn't like the therapist the first session doesn't mean you should cancel or fire them out. I always recommend giving therapists 3 sessions, because sometimes the first session you're just so anxious with that person that you're not really able to get a connection. And then sometimes therapists have off days. So just kind of be patient. Give yourself as well as a therapist 3 sessions to just kind of see if this works or if it doesn't. So before you even get into the therapist chair, some things to kind of think about or keep in mind is, first, let's talk about finances. When it comes to therapy, there's a broad range of what costs can look like. Some therapists take insurance, some therapists don't. I will say, as a therapist, taking insurance can be very tricky. It's a lot of paperwork. It can be a lot of time in getting paid, and it just makes it very complicated for some therapists. However, I do believe in accessibility, so I believe that it's important that a therapist take at least one panel just to kind of help other people out, but that's not everybody's practice, so I don't want to. We'll get into that maybe at a different time, economic disparities when it comes to mental health. But if you are using insurance, make sure you contact your insurance, not the therapist, but your insurance directly, and ask them who's paneled with them, and ask them directly what your copay could be, or what your deductible is. It can say, your copay is $20, but your copay is only $20 after you meet a $3,000 deductible. So now you have to pay a lot more than just $20, and then you have a bill and you don't know where that's coming from. So you need to first check with your insurance and see if see what your costs are and see who's paneled. A lot of people just go straight to Psychology Today, therapy for Black girls, all these other sites, and just find therapists they like, and then they don't realize that they don't have the resources to cover them. So start with your resources, and if you have insurance, start with that. Then, if you're not using insurance, just kind of keep in mind what the price range is that fits you. On average, therapy, depending on what region or area you are in, costs anywhere from about $100 up to $300 standard. I know, and I'm in Nashville, Tennessee, so the average range is about $100, maybe $150. If you have a specialty, like for me, I'm a sex therapist, I've seen some people go up to $350. I think that's a little bit high. It's pretty high for someone in Nashville, but that's something that people can do. This video is probably going to be a little bit longer than 5 minutes because I have a lot of information about this, but I'm going to keep it less than 10. So I just want to let you know that now, since I'm hitting the 4 minute and 30-second range. So just kind of keep that in mind, that the average rate is $100. Some people may go a little bit lower, but really if someone's going lower than 100, they're probably not covering their own fees. So just kind of keep it in mind, because some people are just like, all I can afford is $15. Like, if you I would say 15. You probably need to go more to a community mental health person than a that's actually funded by grants versus actually someone who's a private practitioner, because technically that person's getting $15, which isn't really a basic living wage in some ways, and then they have to pay for overhead. So that $15 can easily turn into $5. So that's not really a range that most private practitioners can manage. So the $100, then they may be bringing home $40, and $40 still is in some ways low, depending on where you're living and what your expenses are and all the education you may have paid for. So just kind of, some people want to know, like, why is it so expensive? And it's like there's a lot of overhead in some ways when it comes to mental health that the therapist has to take care of. And it's just, you have to invest in your care, bottom line. People will pay $300 to get the hair done or get eyelashes, and they won't take care of their emotional health. This is about taking care of your emotions. So sometimes you got to pay money to get that taken care of. It's cheaper for me. Like, I do a lot of couples work. It's cheaper to come to me for 3 months than it is to get a divorce. And trust me, I do help people get out of many, many different difficult situations when it comes to couples. And I've seen magic happen. So I know a lot of people are just like, oh, how does this work? I don't believe anybody but the person I'm in this room, me and my partner, we have to do it all by ourselves. But therapy can do magics on you as an individual as well as you and your relationships. So moving on, one thing also to look for when you're trying to seek therapy is look at one, what schools did they go to? How long have they been out of school? What modalities have they been trained in? So for me, I do trauma work sometimes. I do a lot of trauma work. So I am trained in EMDR, which is eye movement desensitization and reprocessing therapy. You can Google that in more detail. And maybe I'll actually do a video on that. But, you want to see, do they have special skills? Again, I'm a certified sex therapist. So that's something that you're going to be looking at every kind of specialization someone has. They might be charging a little bit more based on what your need is. So if you might need something that is I'm just kind of dealing with basic life stuff, you might not want to go to someone who has all these specialties, so that you can go to someone who can be a little bit more affordable based on what your needs are at that time. If you're looking for someone who does couples work, trust me, a lot of people will ask if someone's married or if they're not, and that is not a defining factor if someone is good at doing couples work. It takes being able to hear very clearly two different languages at the same time and connect and collaborate. And that's not something everybody can do, married or not. It's about being trained and being skilled based on whatever trainings that you've been to kind of be able to hear different sides of the story. So you kind of want to look, when you're searching for couples therapists, if they've done Imago, if they've done Gottman, if they've done PACT. There's a couples institute, but you'll see like different things in their in their biography or in their skill set that will let you know that they're doing couples. Like I said, the same thing like for sex therapy. If you're seeking someone who's a sex therapist, you want to see if they're AASECT certified. There's a difference between AASECT and then there's CSAT, which is sex addiction model. Again, we'll get on that to another time. But you want to kind of see what are the people's specialties if it's something that you're looking for. I know a lot of people look for race, they look for gender, they look for age as means to find a therapist. I think it shouldn't be about age. It should be about the credentials and the specialties. I would say if you're going to look at, it shouldn't be about age, but you should be looking at time period outside of school. So there are people who are in their 70s where this is their third career, and you're thinking, actually, this is going to be probably 15 minutes. I'm close to 10. So anyways, I'm going to keep moving. So people will look at them and they'll say, oh, this person is very experienced because they look older. But really, if you looked at their bio, they've only been out of school 1 year, and the same thing, if you're looking at someone who looks younger, they could have been out of school for 10 years, but you really want to look at date, finish school, just kind of get an idea of where someone is in their experience with working with people. Again, people look at race, they look at gender, they look at a lot of other things too. And I would just say, just because someone is not your same gender or your same race, don't discount them, because they actually might have more empathy. And I'm not saying that just because someone's outside your race that they have more empathy, but it's more so that clinician may just be more skilled and can connect with you in ways that you would be surprised someone who doesn't come from the same background can. So just kind of be open-minded with who you see, and don't discount someone just because they don't follow the same ethnicity that you come from or the same gender that you come from. I know for me, I see men that have premature ejaculation, delayed orgasm, erectile dysfunction, prostate cancer, blah, 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 blah. And and people will be like, well, how can you help them? You don't have a penis. And I'm like, I could be a cardiologist and have never had any type of hypertension or blood, any type of heart condition, but I can do my work because I've been trained and working with people who have heart conditions. So, just because someone doesn't have the same body parts or the same skin color, the same whatever, doesn't mean that they can't connect to you. So just keep it open. That is pretty much those are pretty much the primary things to look for and to think about. If you have questions, if there are other things you'd like to know when it comes to finding a therapist, or just things to kind of keep in mind, please feel free to inbox me, or you can write in the comments, and I will help you out as much as I can, because this is my passion. I just believe everybody can use a therapist. Also, that's one other thing to add. Don't trust a therapist that hasn't been on the other side of the couch. There's something powerful about someone investing in the work that they work in. And one of the best investments a therapist can make is investing in themselves and having a therapist too that helps them see themselves clearer and make sure that they are taking care of themselves. Also, you want to make sure, if you're going to ask, if in addition, it's important to see if they're seeking consultations at the same time, because for me, I'm in several consultation groups. I have consultation groups where I'm talking to professionals about couples. I have consultation groups where I'm talking about everything. I have consultation groups where I'm talking about sex. I have consultation groups where I'm talking about people of color. But I want to always make sure I'm never working in isolation, because a therapist that works in isolation is one step closer to malpractice. So those are some of the things that you kind of want to think about and look for when you are seeking a therapist. I don't know and I think if anything, I don't think there's anything wrong with asking a therapist if they're seeking therapy, because we're here to normalize the practice. So those are my primary tips. I hope this was helpful. I hope you have a good rest of the day.